Hi, I'm Sian, one of the osteopaths at Bridge to Health. This month's newsletter is about pregnancy and the ways that different therapies can help support you. So this is just explaining that in a little bit more detail. So why might you see an osteopath during pregnancy? I'll just break it down into three main reasons. The first one is an osteopath will be able to help you identify any specific structural differences that are relevant to you. So it could be that you've got rounded shoulders, you might have a shoulder impingement, you might have an increase in your lower back curvature that would just make it more difficult for your body to be able to accommodate the changes that happen during pregnancy. If you're able to identify these early on and work into these areas, there's far less chance of them being exacerbated throughout various stages of pregnancy. The second way an osteopath can help is to prepare your body for the changes that occur. So pregnancy is a time when your body changes a huge amount in a really short space of time, and sometimes it's hard for the body to keep up with that. Main changes that occur are that your body's centre of gravity shifts forwards, and that tends to put a lot of strain on the lower back and the pelvis. But an osteopath can help you with that by mobilising these areas, stretching and working into shortened, contracted muscles, and giving you exercises to do to be able to reduce any pressure to the joints that are affected. Another main change that occurs during pregnancy is rib cage expansion. So as the uterus grows, it pushes the organs up, and the only thing that can happen is for the rib cage to be able to flare, to be able to accommodate this. Quite often this causes a lot of middle back tension. It can refer up to the upper back and neck, can cause pain on the front and the sides of the chest. But there are lots of things that can be done to make this a lot more comfortable. So an osteopath can mobilise and manipulate these joints. They can give you very specific stretches and strengthening exercises to really work on your posture and reduce any of those changes around the rib cage and the spine. So that's the second reason. And the third reason is an osteopath can help you, they can help you diagnose and treat very specific pregnancy related issues. So things that spring to mind are pelvic girdle pain, which is quite an umbrella term for pain anywhere in the pelvis. So that can be either sacroiliac joint or the pubic symphysis joint at the front. Usually pain there is because either of the weight of the baby, or sometimes it's because of increased movement due to hormonal changes that affect the ligaments. But again, an osteopath will be able to do specific tests, help you identify that is the issue, and then give you specific strengthening exercises to stabilise the pelvis. Another change that is, or another specific pregnancy issue is outside hip pain, which is because you're encouraged to lay on your side during pregnancy because it's healthier for the baby. But that persistent laying on the side with the increased weight from the baby can really irritate structures on the side, contributing to tendinitis and bursitis. But an osteopath can help you get the correct diagnosis, give you very specific stretches, work into the areas to try and alleviate that as much as possible, and generally make the whole pregnancy experience a lot more comfortable. So if that sounds like anything you are experiencing or struggling with, and you have any further questions, then feel very welcome to get in touch.